Mula Luzon, Visayas at Mindanao, tara na at tumutok. Sa ating viewers mula sa Facebook at YouTube pages ng DOH at syempre pati na rin sa ating mga media partners, welcome to today's Kapihan session with media. Ako po si Jaren Mateo, ang inyong kuya at kabalikat mula sa Kagawaran ng Kalusugan. Pero syempre bago natin simulan ang diskusyunan, narito ang ating house rules. To ensure the smooth flow of this session, everyone is encouraged to, number 1, use the naming convention for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep microphones muted while speakers are discussing and presenting. And number 4, should you have questions, participants shall signify and send them in the Zoom's chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by the Zoom chat box questions. Every participant is advised to reserve their questions as well. Only questions related to the topic discussed will be entertained. And of course, inaanyayahan po namin ang lahat to join the meeting until the last part of the session. Alright. So over the past few weeks, nakita nating maraming tao ang nagkakahawaan at nagkakasakit. Kaya naman higit na importanteng maibahagi natin ang iba't ibang paraan upang gumaling at makaiwas sa mga ito. At dahil dyan, for today's Kapihan session, ating gugunitain ang World Antimicrobial Resistance Week. And actually, this topic is very timely because actually according to the World Health Organization, AMR or antimicrobial resistance is considered as one of the top global public health and development threats. At syempre upang talakayin ang kung ano nga ba ang antimicrobial resistance, we have here today Ms. Joanna B. Malyari Abella. Ms. Joanna is a registered pharmacist and a master of public health. She is also currently serving as Pharmacist 5 under the Pharmaceutical Division of the Department of Health. Good afternoon po, Ms. Joanna.
Hello, good afternoon, Jaren, and to all our viewers. Good afternoon to everyone.
Alright po, simulan na natin ang diskusyonan. The floor is yours po.
Thank you very much. Allow me to share my screen. Okay. May I kindly confirm if nakikita niyo na po ang aking slide?
Yes po, Ms. Joanna.
Okay. First of all po, we would like to thank you for the opportunity to discuss about antimicrobial resistance as we are celebrating the World Antimicrobial Resistance Awareness Week this week po, from November 18 to 24. So this will be the outline of the presentation. So we will first define what antimicrobial resistance is, and then what's the situation at the global and at the national level. Ano ba yung sitwasyon ng antimicrobial resistance in our country, and what is our country doing? What is our response to the AMR threat? And last, before we end, we will just like to share with everyone yung ating awareness campaign on Philippine AMR Awareness campaign, or what we call PAAW. So first, let us define what antimicrobial resistance is. And for us to define this, we would like to clarify first, ano ba yung antimicrobials or antimicrobial agents? So when we say antimicrobials, ito po yung mga medicines natin or mga gamot that kill or inhibit the infecting organism. So these are the medicines that are used to manage mga infectious diseases. And antimicrobials is an umbrella term. It can refer to our antibiotics, very common, very commonly used, and maybe our public are very familiar with antibiotics. They are also known as antibacterials. We also have antivirals. So yung antibiotics natin, they work against bacteria. Yung antivirals, these are medicines that work against diseases that are caused by viruses. Mga antiparasitic agents naman po natin, they work against parasites. And yung antifungal, ang mga kalaban nito ay mga fungi. So what now is antimicrobial resistance or AMR? So AMR is when the microorganisms such as bacteria, viruses, fungi, parasite, these microorganisms that cause infection, they survive exposure to a medicine that would normally kill them or stop their growth. So parang kumbaga, what doesn't kill you make you stronger. No? So these microorganisms, they become superbugs. No? And what's concerning is that this phenomenon happens or develops quickly. It is a natural phenomenon, but yung certain practices natin in the human health, animal health sector definitely hasten yung development of antimicrobial resistance. So this figure shows that over the years, we have witnessed the development of AMR with the introduction of antimicrobial agents, which seem to tell us that organisms have the ability to outsmart us, no? Kasi kapag na-expose sila dun sa mga panlaban natin against them, they are able to develop mechanisms para the next time around na ma-encounter nila yon, hindi na sila basta-basta mamamatay. So once resistant strains of bacteria are present in a population, exposure to antimicrobial drugs favor their survival. And if this is left unaddressed, it is expected that the number of infected patients and animals that are faced with limited options for treatment due to pathogens that are unresponsive to antimicrobials will increase, no? And thus, this threatens food security and the achievement of optimal health outcomes in our population. So what's more frightful is that AMR develops quickly, and yet the new antibiotics that we have are scarce na, no? So there are the new antibiotics that are being introduced in the market are declining, and there are less number of agents, no? If the antimicrobials are declining in number, there are less number of agents that combat infections and increasing yung resistance rates natin of pathogens over the years. So therefore, this is a problem. This will become a very huge problem for us in treating and managing common infections. And this AMR also threatens the achievement of different sustainable development goals. So for example, AMR could push 28.3 million people into extreme poverty by 2050 due to high costs of treatment and chronic infections, which threatens achievement of SDG 1 or no poverty. Animals that are harmed by AMR affects the livelihood of farmers and the broader food security, impacting SDG 2 on zero hunger. And AMR compromise the effectiveness of treatments, leading to increased morbidity and mortality. So yung affecting our SDG 3 on good health and well-being. So what are the drivers? No, there are different drivers of antimicrobial resistance, and kasama po dyan yung mga healthcare providers. No, if they do not comply with guidelines, or if there are no available guidelines, if there is lack of training, or if there are poor infection and control practices, this contribute to AMR. On the part of the patients, no, yung mga practices po natin na hindi tinatapos yung gamutan, when we do not adhere to treatment, when we do self-medication, prescription sharing, all of this also contribute to AMR. We also have to acknowledge na meron ding health illiteracy. Sometimes they really just don't know na yung ganong practice pala can result to more harm. And meron din tayong social and economic barriers kasi hindi ma-afford to purchase the entire treatment regimen. The industry also plays an important role, yung integrity of the supply chain. If we have poor quality of drugs, this can contribute to AMR. Yung counterfeit of presence of counterfeit medicines, specifically counterfeit antimicrobials, poor storage conditions, high drug costs, all of this can drive the development and spread of antimicrobial resistance. So what's the global status? The World Health Organization declared AMR as among the top 10 global public health threats. It is estimated that 700,000 people die due to AMR every year. There are 4.95 million people who died in 2019, suffered from drug-resistant infections, and AMR directly caused 1.27 million of those deaths. 1 in 5 of those deaths as well occurred among the children under 5 years old. It was recorded that 200,000 newborns die each year from drug-resistant infections. And if we do not do anything, no, if left unaddressed, 10 million are projected to die by 2050. And apart from impacting our health system, AMR can also impact our economy. No, it could decrease gross domestic product by 2% to 3.5%, with a fall in livestock by 3 to 8%. So aside sa economy, yung food safety din and food security. So how about in the Philippines? What is our situation? We have our antimicrobial resistance surveillance program under the DOH Research Institute for Tropical Medicine. And this program has been monitoring the resistance of various pathogens of public health importance. And they found very alarming rates. We are also conducting point prevalence survey, and the findings from this survey from 2017 to 2021, it was found that the prevalence of antibiotic consumption is high in both adults and pediatrics. In that same survey, it was also found that the use of watch antibiotics is higher compared to access antibiotics. So may classification po kasi tayo ng mga antibiotics, what we call the aware, yung ating access, watch, and reserve. So dapat mas ginagamit natin yung access antibiotics. But in our case, in the Philippines, mas ginagamit natin yung mga watch. And then 15,700 deaths attributable to AMR and 56,700 deaths are associated with AMR. This was from a 2019 Global Burden of Disease data. And then this one shows that in 2019, the number of deaths associated with and attributable to AMR in the Philippines is higher than the deaths from chronic respiratory diseases, digestive diseases, maternal and neonatal disorders. So this is our situation now in the Philippines. So di naman po tayo nagpapayadan. We recognize that this is an urgent concern, and an urgent threat to public health. So this slide shows the key events in our country's effort to combat AMR. So hindi na po natin yan maisa-isa, but in essence, after a country situational analysis was commissioned in 2012, the findings from that analysis provided recommendations on the need to create a policy, legal basis for the creation of an interagency committee to address the AMR problem. So in 2014, the government of the Philippines issued an administrative order creating an interagency committee on antimicrobial resistance, or what we call the IMAR. And this interagency committee is the one responsible in the formulation and in overseeing the implementation of the Philippine Action Plan to combat antimicrobial resistance through One Health approach, which serves as our country roadmap and strategy on how to address antimicrobial resistance. So ito pong administrative order na to was signed by the President in 2014. The IMAR has or is comprised of the following agencies, national government agencies. It is co-chaired by the Department of Health to represent the human health sector and the Department of Agriculture to represent the animal health sector, because the AMR problem not only concerns the human health sector but the animal health sector as well. It has as members the DTI to cover trade of antimicrobials, the ILG to make sure that all our programs and policies at the national level will be cascaded up to the local levels. And then the Department of Science and Technology to generate more, or to have more research and generate more evidence, local information about AMR. Although not included in the AO, pero in-enjoy na rin po natin yung active participation ng DENR to represent the environment sector. And we are also inviting in the IMAR the DepEd, CHED, and TESDA to represent the education sector to ask for their assistance on how we can educate our students, the public about AMR. Recently, we also invited na rin yung NEDA, given that AMR also has economic consequences. No? So ito pong IMAR na to ang nag-develop ng ating Philippine National Action Plan, and ang ating action plan emphasizes the One Health strategy, recognizing na multi-pronged and multifactorial ang problem on antimicrobial resistance. So we need to act in a collaborative manner, no? Multisectoral din po dapat ang approach. So the Philippine Action Plan highlights 7 key strategies, and ever since the implementation and the launching of the Action Plan, we have been doing many activities na po for each key strategy. No? Kasama dyan yung multisectoral engagement, strengthening surveillance and laboratory capacity, ensuring uninterrupted access to safe and quality assured antimicrobials. No? So FDA plays an important role in this. Regulate and promote the rational use of antimicrobials. So we are cascading yung ating National Antimicrobial Stewardship Program. Implement appropriate measures to reduce infection across all settings. No? Very important ang infection prevention and control practices. And then promote innovation and research on AMR. And yung last na key strategy po is improving awareness and understanding of AMR through effective communication and education. No? So this just shows that the One Health approach, it holds that the human health or the health of human beings is connected to the health of animals, the plants, and our shared environment. No? In this illustration, the inner circle illustrates how antibiotic resistance is spread in a healthy and diverse bacterial population. No? So interrelated po tayo, so we need to work together in order to address the problem of antimicrobial resistance. So just to inform everyone, from November 18 to 24, we are celebrating the World AMR Awareness Week, or WAAW, and we locally call this as Philippine AMR Awareness Week, or PAAW. The global theme is preventing antimicrobial resistance together, no? Highlighting the One Health approach, no, to combating AMR. Our local theme is sama-samang magtulungan upang antimicrobial resistance ay mapigilan. So we enjoin everyone, no, to join the fight against AMR. Go blue for AMR awareness. No, blue is the color of the global WAAW campaign. Take the pledge to be stewards for the future. No, you can scan the QR code or go to this link. No, we are raising 1 million pledges. Yung mga red po na bilog dyan sa mapa ng Pilipinas represents the number of people, no, na nag-take ng pledge in that area of the country. So please take the pledge. Let us all be responsible in how we use our antimicrobials in order to prevent and mitigate the emergence and spread of AMR. So, happy World AMR Awareness Week, everyone. Maraming salamat po. And back to you, Jaren. Thank you.
And there you have it. Maraming salamat po, Ms. Joanna, for that very in-depth discussion tungkol sa antimicrobial resistance. And indeed, happy Antimicrobial Resistance Awareness Week din po sa inyo. So mula hindi na po natin patatagalin, tayo po ay tutungo na sa ating question and answer portion. Okay, so first question po, Ms. Joanna, what are the key data points used to measure the impact of antimicrobial resistance in our country? I believe this was mentioned already in the presentation, so reiteration na lang po para sa ating mga viewers. Ms. Joanna, I think you are on mute.
I'm sorry.
Thank
you. So yung data that we collect, as mentioned earlier, we have the Antimicrobial Resistance Surveillance Program. So in this program, they monitor yung resistance patterns. No? So we have mga sentinel sites. No? This surveillance data is derived from the result of bacterial culture, no, from patients from the sentinel sites of the ARSP program. And then CRITM, which serves as our national reference laboratory, they collect isolate data coming from the sentinel sites, no, in 16 regions of the country, and sila rin po yung nagpa-publish ng annual report, no, on the resistance patterns, yung trends. No. And then aside from that, another data point that we collect is yung point prevalence survey. So kung yung ARSP ang kinokollect doon is resistance data, sa point prevalence survey naman, we collect consumption data. No? So how we use uh, antimicrobials, yung mga prescribing patterns. Ang makikita naman natin doon, yung mga prescribing patterns in health facilities. No? So this survey is also led by the RITM, and like right now, they are doing a national dissemination forum to disseminate the findings of the point prevalence survey to relevant stakeholders. No? So yun.
All right, thank you po, Miss Joanna. And actually, it's nice to hear na the country is really doing something to fight antimicrobial resistance. Siyempre, hindi lang yung national, but also gumagapang din siya sa ating regional counterpart. So
Yes.
So it's really a nationwide effort talaga to fight AMR. Okay. So the second question is, how does DOH leverage data analytics to address the challenge of antimicrobial resistance?
Okay. So itong mga data that we are able to collect from our program and from our survey, these are very important to help us assess and evaluate the impact of our programs and activities. So as I think I mentioned earlier, one of our strategies to optimize the use of antimicrobials is the cascading of the National Antimicrobial Stewardship Program. And this program it's a concerted and systematic way for our healthcare providers in facilities to rationally prescribe, dispense, and use antimicrobials. So yung data from AMR and AMC, or yung antimicrobial resistance and antimicrobial consumption data, they are intricately related. And yung monitoring nito mga data na to, they are very useful in evaluating our interventions for antimicrobial stewardship and in informing clinical practice and policy. So yung mga findings then from the several researches, like for example, yung analysis na kinomisyon ng 2012, that was also instrumental to informing the government on the actions that we need to do and ano yung mga policy issuances that we need to that need to come out in order to address the growing problem of AMR.
All right, thank you, Miss Joanna. And maganda rin siya kasi continuously improving yung ating monitoring and surveillance for AMR in the country because of these efforts that we're doing as well. All right. So for our third question, ayan, this was already mentioned in the presentation. So again, reiteration po para sa ating viewers. So what efforts are being made to raise public awareness about the appropriate use of antibiotics and antimicrobial medications? And then another a follow-up po to this question, how do the LGUs and other stakeholders play into these initiatives?
Okay. Very important po yung role ng LGUs. As you may know, in the Philippines we have a devolved healthcare system. So very important yung role ng ating mga local government units in making sure that our programs and policies from the national level are cascaded up to the grassroots level. So that's why in the IMAR or yung Interagency Committee on AMR, sinama talaga natin doon as a member si DILG. And the IMAR meets every quarter. So we try to work with the relevant sectors to make sure na aligned yung priorities and strategies natin and to make sure na whatever the priorities are in the IMAR, nakakascade yan sa kanya-kanyang sector. For our awareness raising, it's one of our key strategies in the Philippine Action Plan to combat AMR. So part of the things that we do is yung participation in the global celebration of World AMR Awareness Week every November, third week of November, specifically November 18 to 24. And apart from that, we realized na dapat hindi lang tayo every November active. So this year, and in an effort to try to continuously raise awareness on AMR, in collaboration with the Communications Office of the Department of Health, we post po mga social media cards sa Department of Health Facebook page, no, discussing about antimicrobial resistance, ano ba siya, paano siya nangyayari, and what can we do to contribute to mitigating this problem. And apart from that, yung education din natin ay kasama din po dyan yung pagtitrain natin ng mga healthcare facilities, no, yung mga hospitals natin, and even the primary healthcare facilities. We are cascading the antimicrobial stewardship training program. Just to also share, we partner with our counterparts in the region and even with our hospitals. So for example, for the celebration of Bao this November, our regional offices or yung mga DOH CHTs, they also have their own set of activities, no? Mga community advocacy events and awareness raising campaign. Even our public hospitals, no, may mga ginagawa din po silang mga lecture, fora, seminars in their facilities, no, to raise awareness on AMR to the healthcare providers within their institution and to the patients and general public as well.
All right, thank you po, Miss Joanna. And I love that it really is a multi-sectoral approach like you mentioned kanina during the presentation. Kasi makikita natin talaga na tulong-tulong yung bansa para ma-prevent and maiwasan pa ang paglala ng AMR sa Pilipinas. So actually we just received a Zoom chat box question. This is from Willard Cheng of ABS-CBN. So tips na maaaring gawin ng mga mamamayan para labanan ang AMR.
Yes, very important question po. Na ito po talaga yung hinihikayat natin, no, ang general public, no, even yung simple way natin ng personal hygiene, no, always washing of hand, proper etiquette kapag inuubo, paggamit ng alcohol and sanitizer. These are very important, no, to prevent the spread of infections, including drug-resistant infections. Very important din po ang pagpapabakuna, no? Because our vaccines, they are there to prevent yung mga vaccine-preventable diseases, no? And mga vaccine-preventable infections. Likewise, please consult your doctor first before taking antibiotics or any antimicrobial agents. No? Wag po tayong mag-self-medicate and wag din po nating i-share yung prescription natin sa iba. No? So kung sa tingin mo gumana yung gamot na yun sa'yo, tapos nakita mo ganun din yung symptoms ni neighbor, tapos i-share mo, hindi po tama yun. No? So sa case po ng antimicrobial resistance, sharing is not caring. No? So please do not share your prescription. And very important to follow and to use your antibiotics as prescribed by your doctor. No? I-take po natin yung tamang dose, kung kailan siya kailangan, kung kailangan 7 days, take the antibiotic as directed by the physician and always finish po the prescribed treatment regimen. Kasi yung misuse and abuse of antimicrobials, yan po talaga ang nagpapabilis ng pag-develop ng antimicrobial resistance.
Alright, thank you po Miss Joanna. And actually, maganda yung sinabi nyo, no? Kasi yung mga tips na minention natin, in a way, yung mga Pilipino, nakasanayan na natin siyang gawin.
Yes.
Diba, laging mag-sanitize, observe proper hygiene, of course. And actually, important din yung sinabi nyo na magkumonsulta muna sa inyong mga doktor bago uminom ng mga ng kung ano-ano antibiotic or antimicrobial agents. Kasi actually as Filipinos, we should also do our part as individuals to always not only double check but triple check kung ano yung mga pumapasok sa katawan natin ng mga gamot, kasi syempre hindi natin alam kung saan yun nanggagaling, so always double check na lang din. Yeah. So I believe we are down to our last 2 questions po, Miss Joanna. So our second to the last question, what are the key actions used to prevent the abuse of antimicrobial medications?
Okay. So yun nga po, no, yung pag-train natin ng ating mga healthcare facilities on antimicrobial stewardship, ito yung one way in order to prevent abuse, no, and to really be responsible and prudent, no, in prescribing, dispensing, and using antimicrobials, no. And then not just in the human health sector, but in the animal health sector as well, makikita po kasi natin dyan talaga yung abuse, no? Sometimes, if may abuse na ng antibiotics in the human health sector, meron din po sa animal health sector, no? Sometimes, antibiotics are used as growth promoters, and hindi po tama yon, no? So, we also call on our livestock stakeholders to please observe po, no, yung proper na and responsible na paggamit ng antibiotics in the veterinary and livestock sector, no? Kasi nakaka-contribute din po yan, no? Nakaka-threaten din po yan sa ating food security kapag may mga maiiwan na antimicrobial residue in the meat, no? In the food meat that we eat. And ayun nga po, in order to prevent abuse, no, the FDA has a no prescription, no dispensing policy. So this is a game-changing policy po, no. If you can observe po, no, sa mga big chain, no, na mga drugstores, hindi na sila basta-basta nag-dispense, no, ng mga antibiotics na walang prescription. So kaya important po talaga na magpakonsulta muna tayo kung kailangan man talaga ng antibiotic, bibigyan tayo ng prescription. Wag po tayo mag-self-medicate.
Alright, thank you po, Miss Joanna. And actually, maganda yung sinabi nyo doon na hindi lang sa human health sector but also animal health. Kasi makikita natin na interconnected konektado yung dalawa. 'Di ba? So yun. On to our last question po. Actually, this was mentioned po earlier in the presentation. Ano po yung pagkakaiba ng watch antibiotics and access antibiotics? Para lang po maliwanagan din yung ating viewers.
Okay, sige po. For our viewers, no, yung WHO po kasi gumawa siya ng categorization or classification ng mga antibiotics. No? Meron po tayong tinatawag na AWARE. A stands for access, no? So ito po yung usually mga broad spectrum, no, na mga antimicrobial agents na pwede siyang ibigay, no, kapag hindi ka pa sure kung ano talaga yung specific causative agent na cause ng infection. Meron pong guidelines yan na pina-follow ang ating mga doctors, ano yung mga first line, may mga broad spectrum na pwedeng ibigay, no. Yung mga watch, no, WA stands for watch. Ito po yung mga classification of antimicrobial agents na kailangan mo monitor yung paggamit. So hindi sila basta-basta pwedeng i-prescribe, no, unless sure ka na yung specific na say kung gram-negative or gram-positive, no? Medyo technical na po kasi yung discussion. But just know that our doctors know po, no, kung ano yung mga watch antibiotics na ito. And yung RE stands for reserve. Ito talaga yung mga last line, no? So sila talaga yung mga ginagamit na from the name itself, reserve, no? Reserve ba na dapat hindi mo sila basta-basta gagamitin unless sure ka ano yung specific microorganism na nag-cause ng infection and kung ano yung antibiotic na magiging effective para doon, no? So kaya siya tinawag na reserve kasi sila rin yung mga ginagamit for mga usually mga resistant na infection. So for example po natin ng mga yan ay mga colistin, no, linezolid, mga meropenem. So hindi po siya dapat binibigay basta-basta. Kailangan may guidance ng infectious disease specialist or guided din po by diagnostics, no, susceptibility testing. Sana po naliwanagan.
Yeah, actually po mas I think mas okay yung explanation kasi in a way mas easily digestible siya sa ating viewers. I believe po, Miss Joanna. So, actually, on that note, thank you po, Miss Joanna, for that Q&A portion po. And I believe that ends today's Kapihan session with media. Pero bago po tayo maghiwa-hiwalay, Miss Joanna, konting pabaong mensahe lamang po para sa ating viewers.
Okay, sige po. Thank you, Jaren, and thank you po to our media. Nakita po natin, no, kung ano yung nangyari sa atin nung COVID-19 pandemic, no. The pandemic has taught us that it is crucial to prepare for the worst and to avoid future pandemics. Yung problem of antimicrobial resistance or AMR, it represents a slow-moving pandemic that offers a unique opportunity to proactively develop strategies and interventions to mitigate its impact. So as such po, we should continue to take collaborative and concerted actions to raise awareness on the global health emergency of antimicrobial resistance and to promote awareness on how each one of us can contribute to mitigating the impact of antimicrobial resistance in our health system and for our future generations. So following the theme of this year's PAAW celebration, tayo po ay sama-samang magtulungan upang antimicrobial resistance ay mapigilan. Thank you, Jaren.
Thank you po, Miss
Salamat.
Joanna. So, mula sa Kagawaran ng Kalusugan, nais naming pasalamatan ang mga patuloy na sumusubaybay sa ating DOH Facebook and YouTube pages at syempre sa ating media partners na walang sawang sumusuporta sa Kagawaran. Muli, ako po si Jaren Metayo, ang inyong kuya at kabalikat mula sa Kagawaran ng Kalusugan at magkita-kita po tayo muli sa susunod na DOH Kapihan session with media. Maraming salamat po.